This is Canada, and like almost every other country in the world, it's been dealing with the COVID-19 pandemic since March of 2020. But the country's handling of the pandemic has been an overall mixed bag. Despite having the 12th highest deaths per capita in the G20, Canada fared pretty well in the first few months of the pandemic. Government officials seemed to take things seriously. Businesses shut down and the healthcare system managed to stay afloat. Canada was even a world leader in securing contracts with vaccine manufacturers, securing more vaccines per capita than any other country, according to Canadian Prime Minister Justin Trudeau.
One of the best ranges of vaccine portfolios of any country in the world, and we've secured more potential doses per Canadian than anywhere else.
But Canada's pandemic performance began to stumble when it finally came to rolling out the COVID-19 vaccine, especially compared with its southern neighbour and other countries like Israel or the United Kingdom. By April of 2021, Canada's vaccine rollout lags far behind many of its closest allies, with the country's largest provinces drowning in a horrific third wave driven by variants of the initial coronavirus. The country has even been forced to delay second doses of vaccines by up to 4 months just to get every Canadian inoculated this summer. Put bluntly, Canada has a vaccine problem, and it's a problem which really doesn't have any quick solution. The root of Canada's vaccine problem lies in the simple fact that Canada can't produce any of the currently authorized COVID-19 vaccines here at home. None of the corporations who produce any of these vaccines have relevant production capabilities in Canada, and despite requests from the federal government, none were willing or able to build production sites in the near future. The facilities which currently produce the COVID-19 vaccine are massive and complex operations, in some cases almost the size of an entire city block. And for better or for worse, Canada's current business climate doesn't present a competitive opportunity for long-term investments in its pharmaceutical industry. So without the ability to produce the COVID-19 vaccine domestically, Canada is instead stuck importing the vaccine from multiple production sites located across the world. Canada's shipments of the Pfizer vaccine are mostly imported from the company's facility in Puurs, Belgium, while shipments of the Moderna vaccine come from Switzerland. Doses of AstraZeneca have been mostly manufactured and shipped from the Serum Institute in Pune, India, but the United States, under President Biden, has recently loaned Canada 1.5 million of its own AstraZeneca doses earlier this year. All of these doses are loaded onto planes, flown into Canada, and then distributed throughout the country, with each individual province then responsible for delivering shots into people's arms. But with Canada relying on imports, Canadians have been at the mercy of production disruptions and cases of vaccine nationalism which continue to threaten Canada's supply. Modifications to Pfizer's facility in Belgium left Canada short of its expected vaccine shipments in February of 2021, and potential export bans proposed by the European Union and the Indian government continues to threaten Canada's access to vaccines in the coming months. To overcome these challenges, the federal government has invested hundreds of millions into domestic production capabilities here in Canada, putting nearly $173 million towards the construction of a facility in Quebec City operated by Medicago. But the facility won't even be fully operational until at least 2024, which means that Canada's vaccine rollout will have to continue to rely on imports for its current fight against the COVID-19 pandemic. It wasn't always like this. Decades ago, Canada had a robust pharmaceutical industry with multiple facilities producing life-saving vaccines for global markets. But a combination of government policies and a changing pharmaceutical industry has resulted in the hollowing out of Canada's pharmaceutical sector since the 1980s. Companies like AstraZeneca and Johnson & Johnson have shuttered facilities across the country as recently as the 2010s, cutting costs as they faced billions in lost revenue due to shifts in patent protections. Another hit to Canada's vaccine production capabilities came through the gradual privatization of the publicly funded Connaught Laboratories in the 1970s and 80s. Once a world-renowned non-commercial public health entity, Connaught Labs was famous for its production of life-saving vaccines for polio, smallpox, and typhus for Canada and other countries around the world. Because it was a non-commercial entity, Connaught Laboratories was able to make its vaccines cheap and readily available, positioning Canada as a global leader in vaccine manufacturing. But Connaught Labs was partially privatized in 1972 by the first Trudeau government, only to be eventually fully sold by Prime Minister Mulroney to the French pharmaceutical corporation Institut Mérieux in the 1980s. Institut Mérieux eventually went on to become Sanofi Pasteur, which still maintains some vaccine production facilities in Toronto, Ontario. With almost 40 years of hindsight, the privatization of Connaught Labs has once again emerged as a topic for debate. Proponents of the decision claim that financial troubles and a changing landscape made privatization necessary in order to keep Canada's biotechnology sector afloat. But critics still maintain that the existence of a publicly funded public health entity like Connaught Labs would have been a deal-breaker in the fight against the COVID-19 pandemic and any future health crisis. But the history of Connaught Laboratories aside, no matter what decisions the federal government or its provincial counterparts make in the coming months, Canada's vaccine problem is here to stay for at least the remainder of 2021. Canada is expecting a surge in shipments of vaccine doses throughout the coming months, but inoculating Canadians will still depend on imports from countries who are similarly in the midst of a massive vaccine rollout themselves. Canada's vaccine problem needs a long-term solution, one which ideally ensures that the country is capable of making vaccines for the next pandemic here at home in Canada.